Welcome to the Living Healthy with COPD YouTube channel. Subscribe to get daily videos. Also hit the notification bell, and if you like the video, hit the like button. We make videos all about what it is like to live with COPD. The topics range from supplements, diet, exercise, spirituality, medications, and overall healthy lifestyle. Enjoy. Chronic obstructive pulmonary disease is a common lung disease. Having COPD makes it hard to breathe. There are two main forms of COPD. 1. Chronic bronchitis, which involves a long-term cough with mucus. 2. Emphysema, which involves damage to the lungs over time. Most people with COPD have a combination of both conditions. Causes: smoking is the main cause of COPD. The more a person smokes, the more likely that person will develop COPD. But some people smoke for years and never get COPD. In rare cases, non-smokers who lack a protein called alpha-1 antitrypsin can develop emphysema. Other risk factors for COPD are: 1. Exposure to certain gases or fumes in the workplace. 2. Exposure to heavy amounts of secondhand smoke and pollution. 3. Frequent use of a cooking fire without proper ventilation. Symptoms may include any of the following: 1. Cough, with or without mucus. 2. Fatigue. 3. Many respiratory infections. 4. Shortness of breath, dyspnea, that gets worse with mild activity. 5. Trouble catching one's breath. 6. Wheezing. Because the symptoms develop slowly, many people may not know that they have COPD. Exams and tests. The best test for COPD is a lung function test called spirometry. This involves blowing out as hard as possible into a small machine that tests lung capacity. The results can be checked right away. Using a stethoscope to listen to the lungs can also be helpful, showing prolonged expiratory time or wheezing. But sometimes, the lungs sound normal, even when a person has COPD. Imaging tests of the lungs, such as X-rays and CT scans, may be ordered. With an X-ray, the lungs may look normal, even when a person has COPD. A CT scan will usually show signs of COPD. Sometimes, a blood test called arterial blood gas may be done to measure the amounts of oxygen and carbon dioxide in the blood. If your healthcare provider suspects you have alpha-1 antitrypsin deficiency, a blood test will likely be ordered to detect this condition. Outlook, prognosis: COPD is a long-term, chronic illness. The disease will get worse more quickly if you do not stop smoking. If you have severe COPD, you will be short of breath with most activities. You may be admitted to the hospital more often. Talk with your provider about breathing machines and end-of-life care as the disease progresses. When to contact a medical professional: go to the emergency room or call the local emergency number, such as 911, if you have a rapid increase in shortness of breath. Prevention: not smoking prevents most COPD. Ask your provider about quit smoking programs. Medicines are also available to help you stop smoking.